Okay, so we'll look next at the choroid and talk a bit more about that. So it's darkly pigmented. To prevent light from scattering, and it contains the blood vessels that nourish the retina. So that's what the choroid does. If someone is an albino, what color do their eyes look? Pink or red, right? Actually, what you are seeing is that someone that is completely unable to make pigment, they are going to have no color in their iris. So the light, it's going to look clear, 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 clear. Well, why does it look pink? The reason it looks pink is because the choroid also lacks pigment in an albino, but the blood vessels are still there, and blood is red. And so what really you're seeing, if you look at someone that appears to have pink or red eyes because they are unable to make pigment, you're seeing the blood vessels at the back of their eye. It shouldn't surprise you at all that someone that is unable to make pigment in their eye is susceptible to very, very, very poor vision because they're unable to block extra light coming in by the iris, and they're also unable to block light scattering by the pigmentation of the choroid. Okay, then let's look at the sclera just a little bit more. So the sclera, I wrote about it right here. This is hard. Makes it, the eyeball really does feel like a hard, almost like a hard bouncy ball. So it's hard, dense connective tissue. And it gives shape to the eyeball. Yeah, I'm really running out of room here. Okay, so I'll have to box that in. Sorry. So sclera, box all of that in to separate it from some of these other things we talked about. And then why don't we talk the posterior chamber? Let's highlight that. Maybe just take a purple. And all of this was about the posterior chamber. This little talk about glaucoma, and then the role here. Okay, so of course I've saved the best for last, which is the retina. So the retina consists of rods and cones. And what these are, well, so these are neuronal receptors that fire action potentials in response to light. So, does that jump out at you as either central nervous system or peripheral nervous system? And does it do you think it's sensory or motor? It is sensory because the optic nerve here is purely sensory. It's cranial nerve number 2, purely sensory, taking that information to the brain. So rods, they are stimulated to fire action potential just due to the level of light. So like black and white basically. And then cones, they fire their action potentials in response to specific colors. And each color has wiggles through the air at a different frequency, and so each cone is designed to fire an action potential in response to the different colors. You actually have 3 different kinds of cones, but if more than one of them is stimulated by a certain color combination, then that's how we can see all of the colors of the rainbow. So there's a specific part of the retina right back here called the macula. That's going to be the part of the eye that the lens wants to bend the light to shine on, because it will give you good acuity. This area is yellow, and that's how ophthalmologists can see it when they shine a light to look at the back of your eye. And this is caused by adding things like lutein and keratin to that part of the eye. So make sure you get enough vitamin A. Some of the best sources of vitamin A are, like, for example, any kind of animal product, especially red meat. Liver is amazing. In fact, you have to be careful. If you have a little bit of liver every week, you could actually overdose on vitamin A. Most people don't have to worry about that, though. And if you're a vegetarian, you have to be really careful, because the beta-carotene that is in fruits and vegetables, like carrots and stuff, is not always easily converted by different people's bodies into vitamin A. So if you want directly to get vitamin A, you should eat animal products. Eggs would be another good source. Hard to go wrong, though, with liver and red meat. Okay, so within the macula is an area called the fovea centralis, and this is the area of greatest acuity, the sweet spot of your eye. And then let's use a black pen right here. This part of the eye is called your blind spot, because all of the wires, all of the neurons are exiting the eye right there, so there are no receptors there. But your brain just fills in that spot. So even though no information comes from that part of the retina, the eye just is able to fill in the gap. And in class I have a little game we can play that will help you recognize that you do have a sweet spot. Okay, now we'll talk about how vision actually occurs. So the light passes through the crystal clear cornea and then the pupil, and then it should pass through the crystal clear lens, and the lens will bend the light in such a way that ideally it will focus right on the macula, and the very center of it would hopefully be right on the fovea centralis. Anything less than that bending of the light will result in blurry vision. So one of the things that can happen is if the eyeball is too long, then the light is not going to hit on the macula the way it should. So nearsightedness or myopia could be that the eyeball is too long, and specifically it could be that the whole eyeball is too long. It could be that the cornea is too long. Now, an astigmatism is a specific problem just in the cornea when the cornea is maybe steeper in one part than another, and so it's almost like it has a wave in it. So you can see how glasses can correct for either of those problems, because the glasses will change the refractive index of the light so that it will properly hit the back of the eyeball, wherever the back of the eyeball is. So that's nearsightedness. And astigmatism would be a type of that. And then farsightedness that can either be from the eyeball being too short or shortening over time as we get older, or the lens is stiffening with age. It doesn't bend as well as it should. So instead of bending the light enough, it's not bending the light enough to reach the macula and the fovea centralis. You can have this happen if you just study for too many hours in a row. After you've been studying and looking close up for a long time, your ciliary muscle can get tired. It's been doing that for too long. That's not normal. That's not what our eye is designed to do. It's meant to look up close sometimes and then look far away, not all one or the other. So the ciliary muscle gets tired. It's not going to be able to bend the lens as adequately. So after you've been studying for a while, the words on the page may start to look blurry. So laser surgery can, I guess they call it LASIK, and it's really popular these days, and it's all focused on the cornea. They just reshape the cornea. So instead of wearing glasses that correct the bending of the light, they just reshape the cornea so that the light can shine properly on the back of the eye. So you can probably guess, though, if you reshape the cornea, but the lens is still not doing its bending as much as it can, then you're not going to have 20/20 vision after it. But if the whole reason that you have a vision problem is because your eyeball is too long or your cornea is too steep, then they could flatten the cornea enough to compensate for that, and then theoretically you could have perfect vision after LASIK surgery. And if you have an astigmatism, evidently they even now can try and shape the cornea so that it's balanced and doesn't have any waves in it. So that's LASIK surgery. So we've talked about nearsightedness, farsightedness, glaucoma, and what about macular degeneration? That's when the macula itself starts to break down, and it can happen from like debris building up here. They call them drusen. I guess we could put that down here, because it's the most common reason someone would go blind in their elderly years. So and this would obviously obscure central vision. So it's not even like a problem at the periphery. It's right in the middle of what you're trying to look at. And this would be called a dry macular degeneration. And then another kind, although it's less common, is wet. This is the wet version. This is the dry and the more common version. The wet is when blood vessels in the choroid overgrow and damage the functioning of the neuronal receptors. It's almost like a tumor in the choroid. See, the too many blood vessels. So blood vessels in the choroid overgrow and damage the neuronal vision receptors, neuronal rods. and cones. Okay, now I want to finish up this page by talking about what happens with fight or flight to the eye. Effects of sympathetic stimulation. Of the eye. Maybe I'll let you mull that over for a minute, and we'll come back and talk about it in the next video.